So welcome to one of our series of informative webinars about the opioid epidemic, all aspects, but particularly the aspect of prevention. We're the Council to Prevent Opioid Dependence. I'm Rob Horowitz, who's going to be the moderator for the webinar. Pleased to have this month Dr. Mark Vitale, who's been a longtime practicing dentist and also serves as an expert and on call at JFK Hospital, which is a big hospital in the middle of New Jersey, my old home state, and has been very active and is still very active both in the New Jersey Dental Association and nationally, working to get veterans right now, working to get veterans the dental care they deserve, because many of them aren't insured and aren't covered by the VA. And we're going to talk about what's it like to be a practicing dentist and how Mark works to limit the use of opioid painkillers in his practice. So welcome, Mark. We really appreciate you taking the time to join us today from Brick, New Jersey on
Hey,
the
Rob.
water.
It's a pleasure being here with you today. Glad to have
Great.
the conversation about my practice, my experiences, and my personal experiences, both in the practice and also with patients of mine who've had issues with opioids, and of course, the daily challenges of using analgesics for our procedures.
Great. Thanks, Mark. Mark, what got you interested in dentistry in the first place?
I was back in high school. I wanted to go into health professions. I wanted to be able to do something to help people, but I also wanted to own my own business. And after talking to physicians and dentists, I came to the conclusion that dentistry might be a good thing. And I started as a volunteer dental assistant at a community healthcare center. I did that for a period of time, and then I met some folks at the medical center near my house and near my office, JFK, where I'm on staff now, and I became a volunteer dental assistant in a residency program. So by the time I got ready for dental school, I was ready to go jump right in. So I've been doing that now. I've been in practice for 42 years. It's a general practice. So I have a partner, a couple of associates, and a periodontist, and we treat patients in all aspects of dentistry.
That's great. What do you find rewarding about your work with dentistry?
Oh, the patients. Just especially those patients that come to me that have been fearful of going to the dentist or couldn't afford to go to the dentist. And they come in and you spend hours upon hours basically rehabilitating them. And at the end of the day, they come up to you and smile and they give you a hug and they say, thank you. There's nothing better than that. I'm actually going through the process of retiring soon. And now I have patients coming out of the woodwork saying, oh, thank you very much for my smile. I don't know what I'm going to do now because you're the only person I've ever trusted in over 40 years. So it's that part that gives you the satisfaction that I find the most rewarding.
That's great. And what are some of the tough challenges you face as a practicing dentist today?
Right now, I'd say the two biggest challenges are workforce, because I'm a practice owner, and insurance. Dental insurance hasn't changed in the 42 years I've been in practice. I'm involved with the American Dental Association, New Jersey Dental Association on what I like to call dental insurance modernization. You know as well as I, 40 years ago, the maximum was $1,500. Today, it's still $1,500. I find that prohibits individuals from getting the dental care that they want. So that's one of the missions or one of the projects I'm involved in organized dentistry.
And what do you think the prospects are for I know it's been as you said, it's been a long time, and it is one of the barriers for people getting dental care. What do you think the prospects are for improving dental insurance?
I think they're pretty good. I'm involved in political action, and I can tell you the legislators are starting to look at that and paying attention both at the federal level and at the state level. They're realizing, as a result of our conversations with them, that dental insurance hasn't changed, and we're looking at what's called medical loss ratio, which you folks may be familiar with, especially since you're so close to Massachusetts. And we're looking at the profitability of these plans and how much money is spent on premiums and how much money goes back to the patient. And I think there's an awareness that has come forward. I know here in New Jersey and Trenton at our state capital, and I know in DC. So I'm optimistic that dental insurance will reform and will modernize to become more effective in providing patients with what they need.
Great. So you've been a leader and you were out front before others within the dental profession on limiting the use of opioid painkillers to treat pain for dental procedures. What what did you recognize perhaps for some others sort of began to recognize it? And why did you recognize it?
So I guess it started personally and professionally. Back around 2015, 2016, the Partnership for Drug-Free New Jersey was running ads. And they were running ads on opioid abuse, but they were targeting third molar extractions as being the cause of children becoming addicts. And I guess it got a few people at New Jersey Dental Association stirred up. So we decided we need to look into this and see what the truth is and what we can do to help mitigate any problem that may exist, especially with dentists who are prescribing opioids. Ironically, or sadly, however you want to look at it, at the same time, I had a sister who had back surgery, and she was given a supply of Percocets for several months and eventually became addicted to the Percocets. She then could not afford to go buy the Percocets out on the street, which is what so many addicts do, and she turned to alcohol. Simultaneous with that, my son-in-law broke his leg, was given prescriptions for Percocet. Over the course of a month or so, he became addicted to it. He turned to heroin. So this whole personal thing was going on at the same time that this awareness took place at the New Jersey Dental Association, and I got involved. I became the chair of the Opioid Task Force at New Jersey, and then I got involved as a lecturer for Partnership for Drug-Free New Jersey. And I guess a lot of it was a learning process for me, because back when I went to dental school and when I graduated, when I started my practice, the Vicodin rep would walk into my office, hand me free samples of Vicodin and pre-written prescription pads. And every patient that had a root canal or an extraction got a prescription for Vicodin. And now in retrospect, I look at that and said, oh, wow, this is the way society thought back then and the way we felt in medicine and dentistry. And now we've switched 180 degrees. Sadly, we saw the negative effects of those prescriptions. So I can tell you honestly, since that time in my practice, I can't count the number of opioid prescriptions we've written on one hand.
That's great. So how do you talk to then patients about pain, and what do you do as a if you're not writing them opioid prescriptions for pain, what are some of the alternatives that you employ?
Well, I think a couple of things have changed. Over the years, our techniques have improved, our equipment has improved. Now, I like to use root canal as an example because patients always perceive root canal as this painful procedure, especially afterward. And I think years ago when they came out with rotary systems, my partner and I invested in the rotary systems, and we actually saw a decrease in postoperative discomfort. And I think the best way to handle it is when you're talking to a patient, you explain to them, oh, these myths about painful root canals or painful third molar extractions. And I think it's in the wording you use in your explanation that you set it into their head that they're not going to have pain afterward. They may have some mild discomfort. And oh, by the way, we have something we can give you for that mild discomfort. I think over the course of years, just with experience, you learn how to speak to the patients about it. You never use the word pain. You use the word discomfort. You emphasize the fact that techniques have changed, the equipment has changed, and you shouldn't be experiencing pain when you go to the dentist, and you shouldn't experience pain afterward. But if you have some discomfort, we'll give you some Motrin, or we'll give you some Advil, or we'll give you a combination of Motrin and Tylenol. And I explain all these things to the patients. And whether it's coincidence or not, I haven't written a prescription for a Percocet or a Vicodin in years. And I haven't had patients calling, crying in pain. I haven't had patients showing up at my door, demanding a prescription for an opioid. So it's worked. It's worked very well.
That's great. Where we do see still, and you're a leader in this because we do still see, though it's generally because of all the work that the dental association's done and people like you have done and the raising awareness, we're seeing much less opioid painkiller prescriptions written by dentists. There's still a fair amount, and some of it, I guess, is a chunk of it's written probably more by oral surgeons for wisdom teeth extraction, where the research shows in most cases a combination of, as you said, Motrin, Tylenol, works almost as well, or is at least as effective. Do you have any suggestions about how to move forward on that front? Because that seems like one of the remaining kind of hurdles here, at least from looking at the data I look at for anyway.
I think it's all education. It's education of the provider. You know, I mentioned we have a periodontist that works with us. We've had a periodontist on our staff now for 30 years. And for the longest time, he'd be writing for opioids. And I guess just from the educational process, you learn there's no reason to write for more than 1 or 2 days worth of an opioid if you really have to use an opioid. And there are times he does do osseous surgery where he feels a day's worth of an opioid prescription is beneficial to the patient and keeps them comfortable. I'm not going to argue that point because I think sometimes that does occur. As a general dentist, I don't see it, but as a surgeon, he does see it. I think the important thing is to educate the patient that you're going to receive these couple of pills and then nothing beyond those couple of pills. And oh, by the way, Motrin works very well. And I tell them about the scientific studies about Motrin and Tylenol in combination being just as effective as any opioid. And the patients believe it and they buy it. And I think it's great practice management and it's great patient management to educate them and get them to accept that. Because I know for years, I remember years ago, patients would walk in the door and before I even start an extraction or a root canal, they said, "Oh, doc, you're going to give me a couple of Percocets, right?" Well, back then, maybe we said, yeah, we'll see how it goes. Today, there isn't a chance.
For those of us a little less conversant, and I hope I'm pronouncing this right, Mark, osteosurgery, what is that?
Osteosurgery, cutting bone. So
Oh,
during doing
gotcha.
dental procedures, and I'll use, since you brought up third molar extractions,
Go
a lot
ahead.
of times when third molars are impacted, you have to go in and drill through the bone to get the tooth out.
Got it.
Affect the bone, you get a greater inflammatory process, which could result in greater pain. And that was one reason why the first line of defense back then, when I was young, was automatically prescribing a Vicodin or a Percocet. Now I see less and less of that in practice. That's done on a routine basis.
Uh, sorry, just was looking at the, let me remove this. Sorry, I was just checking on the questions. By the way, anyone who has a question for Mark, you can put it in the chat. Apologize for that 15-second unintentional interruption. I, I guess the next question I said, Mark, is does it also require, since do you see only adults in your practice, or do you see teenagers and?
We see a full range, all ages.
Correct.
We do pediatric dentistry right through geriatric dentistry, so we see all age groups.
So does this require also having conversations with parents then, in the case of younger
We actually have, back in 2016, 2017, when the state mandated that you have these conversations and that you have signed consents, I actually, it's funny, I was cleaning out one of the drawers of one of my operatories and I found a stack of these consents that we use for opioids. And I honestly can't tell you the last time I actually wrote it for an opioid or had to use one of these consents. But yes, we do have consents available in the office if by chance we have to give an opioid to a pediatric patient. I've never seen an occasion where we've had to do it. Tylenol has worked very well for children. And again, we're general dentists, so we don't do that much that would inflict that type of discomfort on a child.
Understood. The in your work, tell me a little bit and tell our viewers a little bit about the work you're doing with the American Dental Association relative to veterans.
Oh, sure. A couple of years ago, I served as chair of Council on Government Affairs for the American Dental Association. It was brought to our attention that many veterans, in fact, most veterans, do not qualify for dental care through the VA. In order to qualify for dental care for the VA, you have to have a combat injury that would warrant dental care. So therefore, most veterans, in fact, I believe the percentage is 84% of vets don't qualify for any type of dental care through the VA. We had conversations with the VA to see what we could do. We tried to develop projects with the VA to help vets. Nothing seemed to come to fruition. So as a result, the American Dental Association decided to develop a program called Give Veterans a Smile, similar to Give Kids a Smile, which is many dentists are familiar with. The program was launched last month in New Orleans at the American Dental Association SmileCon. And the goal of the program is to bring national attention to the unmet needs of veterans, to bring that attention to dentists so we can get dentists to volunteer to treat the vets, and bring the attention to the legislators so that we can get legislation passed to increase funding and manpower at the VA to provide dental care to these vets. So the goal right now over the next 2 years is to develop enough grant money, get enough state organizations to participate, and assign vets to various practices nationwide and develop dental homes for these vets.
Well, that's great. In your practice, have you experienced patients who sort of, sounds like not very many, who want opioids, and you get the sense it's because they may have a dependence problem, or is that not something you have to really deal with too much?
Years ago, that was a big concern because we were on staff at a medical center. Initially, when I was the director of the residency program, we saw individuals come into the ER every day. And it was obvious they had a toothache. I hate to put it this way, but they were soaking the toothache to get a prescription for an opioid. And that was a routine thing back early in my career. I can say I've not seen that in my practice in the last now 7 to 8 years. Patients do not even bring up the topic of opioids. And I think there is enough media coverage over the topic to actually scare a lot of people with regard to opioids, especially when they're prescribing for their children.
And in the hospital, when you I assume you at JFK, when you're on call, you're dealing with probably more serious kinds of dental
Well, it's a
issues.
general practice residency. So I deal with the general dentistry, and then we have oral surgeons that deal with oral surgery.
So there's some people who come to the hospital for their regular dental issues.
Yes, there's a clinic with several
Oh, I got it.
residents. Mhm.
Got it. Got it. And is that aimed at probably aimed at everybody? Is that a way to treat more low income
Exactly. Yeah.
people?
They treat hospital employees. They also treat Medicaid patients and individuals who require charity care who can't afford to go to a private practice. And it's been successful. It started back in the 60s. I was a resident there in 83. I was the director of the program in the early 90s, and I've remained on staff since. So it serves a great purpose in our community.
And in terms of the American Dental Association, I know over the last few years they've taken a more proactive approach to opioids. I know they have some continuing education. There's a webinar that prescribes that at least recommends opiate last as opposed to opiate first kind of prescribing. Do you think that's been helpful to dentists in terms of awareness and education about limiting the prescription of opioid painkillers?
Oh, absolutely. I think the education's helped a lot. I know here in New Jersey, it's mandated. So our state board requires a certain number of
Right.
continuing education credits, to maintain your license. So, more and more dentists have been educated with regard to the ill effects of opioids and the alternatives to opioids. The American Dental Association recently openly advertised for Advil's dual action, as a recognized pain reliever because it's a combination of an ibuprofen plus a Tylenol. So they have been advocating for that for quite some time. And just talking to my colleagues locally, most of them have not written for an opioid in a long time.
Interesting. And actually, that's a very good sign. What we've noted up in Rhode Island is the prescribing of opioids by dentists is probably decreased in half or more over the last, say, 5 or 6 years. But there still is, and it's great because the education has happened in New Jersey, but still it's still at a fairly, for example, in the state of Rhode Island's about an eighth the size of it. So a million people, supposed to 8 or 9 million people. You still had 5,000 new opioid prescriptions written by dentists and oral surgeons put together in the most recent year, in 2023. So we're doing, trying to model some of the stuff you're doing in New Jersey to try to do more education so we reduce that, both with parents, particularly because wisdom teeth seem to be the, if there's one nub, it's the wisdom teeth extractions, and the oral surgeons trying to do is do outreach to parents and the dentists to sort of give them the education you already have, because there's still understandable in anything. Dentists are busy, everybody's busy, everybody's got 100 things. There's still some lag in the system, much better than it was, which is great, but still some progress to make before we eliminate this one source of potential source of opioid dependence.
You know, I have to say, I have to give a lot of credit in New Jersey to Partnership for Drug-Free New Jersey. Yes, was there a controversial conversations years ago with regard to the third molar ads, but it did bring about a meeting of the minds, and I think that included legislators. So I think here in New Jersey, the educational process has been rather good. And I know the partnership still runs webinars on a regular basis for healthcare professionals, for the general public, for those who've been addicted, those who know someone who's addicted. And I get the emails all the time. They run
Right.
them all the time. So I think that awareness that's out there here in New Jersey has been very beneficial, because I can actually see a patient going to a physician says, well, we did this procedure or that procedure, you're gonna have some pain, let me give you a prescription for Percocet. And I can actually see a patient saying, oh no, I don't want to take that. Because I've had patients say to me, you're not going to give me a Percocet or a Vicodin, are you? I tell them, no, we don't even discuss that. You're not going to have that. We're going to do this instead. So I think, and like I said, I have to give them credit for the marketing that's been going on and the educational process that's been going on. Plus, like I said too, the mandated CE in New Jersey has helped a lot too.
Yeah, we have that in Rhode Island as well. Rhode Island was the, particularly after New Jersey was the first state to pass not CMEs necessarily, but the requirement for a conversation to occur at the point of prescription, which you're familiar with for all medical practitioners, including dentists. Rhode Island was the second state to pass it. But I do think, even if you look at the overdose numbers, New Jersey is one of the few states. They started to come down, unfortunately, last year too. And as you know, Mark, a lot of that relates to fentanyl, because it's just become more deadly. That's why prevention becomes so much more important, because you have fentanyl and as people graduate to other forms of, as you said, I think it was your son, as people graduate to heroin and those kinds of things, that's become not only horrible because it's so addictive, but also potentially deadly very, very, very quickly, because fentanyl is so potent. So, but I think New Jersey is one of the few states that, even before the general overdoses went down this year, for the last couple of years, New Jersey's overdose rate has stayed lower, and it started to come down even first. And I think some of that is all the education that's gone on there, and the work you're doing, and the work all the folks in New Jersey do, and we're attempting to model a chunk of that in Rhode Island, simply because you want to model what works.
Right, sure.
Because you're trying to eliminate the sources, and also nationally still, just on wisdom teeth, for adolescents, because wisdom teeth are so widely extracted, is one of the, it's still one of the number one sources of where people go from being opioid naive, where we say never used an opiate, to using an opioid, or when they're prescribed for wisdom teeth. And you're probably familiar with, there's a Stanford study that says, pretty big Stanford University medical study that says 6% of folks, after being prescribed wisdom for pain for wisdom teeth, are dependent on opioid a year later. Those not prescribed is like 0.4%. So the kind of work that you're doing, and we're working to get more dentists to do, and I know more are doing, I'm not being critical.
Right. Yeah.
A lot of progress is really potentially life-saving kinds of work at the end of the day. for that small percentage of people that do become dependent very quickly. And as you know, within 5 or 6 days, people can become dependent. Not
Well, I
everyone.
agree. In fact, that's a stat that gets out there to the public and they see that. I think that scares them. It
Right,
doesn't take much to become addicted.
right, right. And as you know, we don't know who. It's not. No one has that foreknowledge. I mean, there's attempts to try to get there with that, but it's so imperfect. It's like trying to predict the winner of the election,
Right.
or the Super Bowl, or anything like that. You might be right, you might be wrong.
Right.
And it's kind of, in this case, it's like Russian roulette a little bit. Mark, anything you'd like to add in conclusion to all this? Because this has been very informative, very helpful, and very beneficial to our listeners and viewers. But any sort of concluding remarks you'd like to make?
I think that this has been for me, this has been an ongoing conversation since, like I said, 2016 between the Dental Association and personal experiences. I think it's a conversation that has to be continually had, and can be reinforced in the dental schools and in the medical schools, reinforced with the CE that's out there for healthcare professionals. But I think the greatest conversation is when you have the conversation with the patients. Patient management is very important, whether you're a physician or a dentist. Being able to communicate with your patients, explaining the procedures you're doing, explaining what they may or may not feel, explaining what you can do to help alleviate any discomfort. I think it works tremendously. I can use this as an example too. I used to have patients that came in with TMJ facial pain. And years ago, we wrote for Valium or something similar to Valium. And now I use Botox. And the pain is gone, and the patients love it, and it's safe and effective. So, we have alternatives out there. And I mentioned already, just changing some of the equipment, some of the techniques in the office have been very beneficial. So I think staying abreast of what's going on within the profession, being up to date with the science and the technology that's out there is the best way to go about it.
That is great. Dr. Vitale, we really like to thank you. And then for our viewers out there, this will be available on our website if you'd like to review it or watch it again, and as well as all the other webinars, informative webinars that we do are available on the Council to Prevent Opioid Dependence website. So you can visit there for information. There's also information on the whole question of dental care and opioids is also on the website, along with a lot of other information. Mark, thank you very much. Really appreciate it.
Thanks, Rob.
And
Really, it was great. Great having a conversation. I appreciate it.
thank you. Thank you. Thanks for your time.
All right.
See you all.